you got scoliosis or spinal asymmetry, and do you find that sitting for prolonged periods of time causes you discomfort or pain? If so, you've come to the right place, because in this video we're going to show you how appropriate seating can really help manage your pain and your general well-being. My name is Jude Brewer. I'm an occupational therapist. I've got experience working in a number of different clinical settings, including care homes and acute inpatient rehab, as well as in the community. Scoliosis is a sideways curvature of the spine of greater than 10 degrees. It commonly affects the thoracic and the lumbar spinal areas. Spinal asymmetry is a more broad term to describe any irregularity in the spinal alignment. The condition can range from mild to moderate to severe or very severe, and individuals who have moderate to severe spinal asymmetry or scoliosis will often require or benefit from specialist seating. Scoliosis can be a progressive condition, so can worsen with age, so it's important to remember that when considering specialist seating, that it's going to be adjustable and be able to meet your needs longer term. So how does scoliosis affect sitting? The curvature of the spine can often result in an obliquity in the pelvis, so a tilted pelvis, uneven shoulders, and a lean to one side. And this uneven weight distribution can impact on the pressure areas, causing an uneven pressure distribution, which increases the risk of pressure injuries. People with scoliosis may not be able to adjust their position independently, so seating that moves for them and does the work for them can be very beneficial in those cases. And prolonged periods of time sitting in a chair that is not appropriate, is not meeting your postural needs, can actually make your condition worse over time. So what is the best sitting position for you if you have scoliosis or spinal asymmetry? It's important for you to have both feet flat on the floor if you can, or resting on a foot plate, and your knees positioned at 90 degrees. And that helps to redistribute pressure away from the lower back. The elbows should be positioned comfortably at 90 degrees because that takes away some of the strain from the shoulders. If you can, using something like a tilting space chair or a recline backrest function allows redistribution of pressure to the further up the back, so again alleviating some of the pressure from the lower back. And if you're able to move regularly, repositioning, stand up every sort of 30 minutes helps with circulation and to reduce stiffness as well. With seating, you aren't trying to correct the scoliosis, you're accommodating that spinal curve. So having a backrest that's adjustable and really comfortable and supportive is helpful with that as well. So what key features are there to look for when you're choosing seating? First of all, you need to look at the type of cushion that you're going to be using. So a firm, sort of high density foam is great for a lot of people. If you do need a little bit more pressure relief, you can look at more of a gel or an air cushion. I would consult with your occupational therapist to really determine which is going to be the right one for you, because it depends on your individual circumstances. You also need to look for something that has an adjustable backrest with lumbar supports and pelvic support and head and neck supports as well. Adjustable width as well, and depth of seat. The tilting space, as I mentioned before, is really great for that pressure redistribution and comfort, as well as the reclining backrest. This is the Lento Cove chair, which offers all the adjustments and features that we've spoken about. It's really, really great for people with any sort of spinal asymmetry or scoliosis condition. For somebody who is a bit more mobile, a bit more independent, something like the Lento mobile chair might be more appropriate for them. When considering getting specialist seating, it is important to have an assessment, because your needs will be very individual. It won't be the same as the next person. So Vivid Care do offer free, no obligation seating assessments in order for you to trial the chairs and see what's going to work best for you. And it's also really important to consult with your occupational therapist so that you know what your individual needs are, and to make sure that the chair is going to suit your needs moving forward as well as your needs change and progress.